going to switch up a lot today, so it's going to be me, Dr. Randolph, the mayor's here, and Chief Alvin Benson.
Oh, okay.
You want to go before the chief?
No.
There's me and you, then if you want to do Mayor Harris. Mayor's going to go first.
So that's all.
You can sit. We still have about 3 minutes. So.
Doctor, you take about half a step to your right.
Huh?
Whatever you do, don't move back to the
I'll try
left.
not to. Go ahead and get started. We're getting close to 2 o'clock. Good afternoon, everyone, and as always, thank you for being here to get the message out to the public on the COVID-19 epidemic and its impact on Shelby County. Today, we're going to have some different presenters. One, we're going to have Dr. Bruce Randolph. He's our health officer, and he is the one that actually is responsible for our health directives and ensuring compliance to those directives. So he's going to give the basic update as well as talk a little bit about what those health directives mean and another health directive that we have in the pipeline. And Mayor Harris is going to give some updates from his perspective as mayor. And then we're going to have Chief Alvin Benson, who is leader of our Shelby County Fire Department, and talk about things they're doing in fire and EMS to reduce transmission. And then we'll open it up for questions as we always do. So I'm going to turn it over to Dr. Bruce Randolph.
Thank you, Dr. House-Halter. Good afternoon. I'm Dr. Bruce Randolph. I'm the health officer for Shelby County Health Department. I was appointed in this position by the Honorable Mayor Lee Harris. I come before you today to give you an update, first on the COVID response here in Shelby County, and I want to spend some time to discuss the health directives and exactly what they mean and the importance of them. As it relates to our update, currently we have 497 cases of COVID-19 in Shelby County. We've experienced 3 deaths. We're notified of 2 additional deaths. Yesterday evening, early this morning, which brings our total to 3. We have tested 5,506, and our positive rate is 9%. That is, we've had 497 positives out of the 5,506 that was tested. Surrounding counties, Tipton reports 21 cases, DeSoto County, Mississippi, 84 cases, and Cleveland in Arkansas, 29. The health department is currently investigating an outbreak at the Carriage Court of Memphis. This is an assisted living facility. The health department tested 22 persons at this facility, including residents and staff. Out of that number, 20 results have returned to us still pending. Of the 20 results, 4 were positive, 16 were negative. Prior to the health department involvement, 2 residents were tested, and their tests were positive, giving a total of 6. And we're currently investigating further. The Carriage Court of Memphis is taking appropriate actions to contain the virus, and those employees who were tested are recovering at home in isolation. The simple breakdown of the cases that we currently have in Shelby County: 21.7% are ages 21 to 30. 16.5% ages 31 to 40. 14.7% ages 41 to 50. And 14.5% 51 to 60. And 12.1% are ages 61 to 70. So as you can see, that a lot of our cases are among young, I would say young folks, 20 to 60, contrary to the belief that only older people are infected by this virus. Not to take up too much time, I want to now just transition over to the topic of health directives. As you may well be aware that a few days ago, I think 2 days ago, Governor Lee issued a statewide executive order to follow up with the executive order that he issued earlier. Both mayors, Mayor Lee Harris of Shelby County, as well as Mayor Strickland of Memphis, and mayors of the municipalities, all issued executive orders. And myself and Dr. House-Palter collectively issued an executive order, a health directive, last week, a week ago today. However, we still are getting reports that people are not adhering to the orders or the directives. And so starting today, as health officer, I'm issuing specific health directives to individuals and to businesses who are not complying with the ordinance of the executive order and the health directives that have been issued. As the health officer, I am empowered by law to be able to issue a directive that requires individuals and businesses to comply with our attempts to prevent and to mitigate this communicable disease, COVID-19. And individuals or businesses who fail to comply can be charged with a misdemeanor. I want it to be very clear that this is not a request, it's not a recommendation, but a requirement that is supported in law. It is necessary that we move in this direction because our numbers are climbing, and as you may have heard, nationally, we're expected to have anywhere between 100,000 or more deaths. And the main tool that we have to try to prevent deaths here in Shelby County is to adhere to what has been outlined in the executive orders and the health directive. Stay home unless you have to be out. Separate yourself at least 6 feet. Cover your mouth and nose, your coughs and sneeze. Wash your hands and clean surfaces often. And stay safe. And let's not gather in crowds greater than 10 or more. Let's not gather at the parks or other places, but simply walk, exercise, and keep your distance 6 feet apart. With that, I will stop, turn it over to the Honorable Mayor Lee Harris, after which we will entertain questions that we may have after Chief speak as well. Thank you.
Well, good afternoon. I am back again. I think the last time I was here on Monday, I will just make a few announcements, and then I think we will go to your questions. I think on Monday, one of the things that this group asked for was zip code or more zip code information related to the number of confirmed cases. And so today, or this morning, we released a breakdown of where the cases are found by zip code. And so that zip code data is where the patient lives. And so hopefully everybody has got a copy of those maps. We disseminated copies here before I took the podium. In addition to that, just to additionally expand and facilitate more communication, we have added health data related to COVID-19 to the county's public portal. So it's just another location to find some of this healthcare data related to COVID. In addition, there are other indicators that we place there as well. So the Shelby County public portal for data is http://data.shelbycountytn.gov. Again, http://data.shelbycountytn.gov. Again, this is just going to be an additional location where we make sure we put the kinds of information that you all are requesting to have. Additionally, today, Judge Campbell has issued an order to suspend all bench warrants in our General Sessions Court. And so he's issued an order that there should be no more bench warrants issued And so that goes into the work that we talked about on Monday with District Attorney Wyrick to reduce the jail population. So a lot of the jail population is a result of failure to appear, at which time judges routinely issue bench warrants, and the sheriff goes and picks up those individuals, and many of them, if not most, end up in our jail while they await some kind of disposition. So Judge Campbell's order today to suspend those bench warrants means that we will see a rapid decline in our jail population. We've already seen a rapid decline. We've talked about the fact that our jail population is at 2,700. Now it's at 1,900. We expect that to go down further with the suspension of the bench warrants. Finally, Shelby County government continues to adapt to this environment. Today, we noticed to our employees opportunity to get free counseling services. We know that we are in a very tough environment where there's a lot of fear and anxiety around contracting COVID-19 or spreading it to members of your family, and all sorts of unique stressors related to this public health event. And so we want to let our employees know, and want to encourage other employers to let their employees know that it is okay to protect your mental health, and counseling is one way to do it. In fact, we have promoted teletherapy, and teletherapy is a way to connect with a professional healthcare provider for your mental health remotely, virtually, by use of a computer. So that'll be available to all our county employees. The teletherapy, we also have the in-person therapy too, but we're really pushing and promoting the teletherapy, which is a new benefit that we've been able to put together in the last few weeks. This builds off our other reforms, which we brought to the commission, like alternative work solutions, which is work at home, which we brought in the last couple weeks, and also our paid sick leave program, which continues to adjust and expanded over the last few weeks. So telehealth, the number, in case you are a Shelby County employee, is 901-458-4000 if you want to set up an appointment for a free counseling session. So with that, I'll just say that Shelby Countyans have made tremendous sacrifices over these last few weeks. We can expect that they will be called on to make even more sacrifices, but we believe, and all of us know, that Shelby Countyans are tough, and so we would ask everybody to stay safe and stay healthy, and we will make it through it. So with that, maybe Chief Benson, actually. Chief Benson, I welcome Chief Benson to the podium.
Thank you, Mayor, for your leadership, and we appreciate it. First responders are literally on the front lines, guys. We are on the front lines and everything that comes with that. Unique challenges associated with being a first responder is something we deal with every day. And one of the things that's real unique is that we're required to make quick decisions with very little time and very little information. That in itself creates its own set of challenges. So what we directed our folks to do, and paramedics and EMTs and ambulances, to wear protective equipment. You've heard a lot about PPE, So our emphasis on wearing that PPE, protecting yourself, because you could too be a victim. And the last thing we want to do is impact the first responders and the health environment in a way that cripples the system. Imagine if paramedics, EMTs, firefighters, law enforcement people overcome at such a level that they can't do their job. So that is our challenge. How do I keep our people safe? How do we provide the necessary care to the individuals in the community that need it, while keeping social distancing and keeping our people safe in the same way? So those are the conversations that we have all the time. So one of the things I do want to talk about is the proper use of 911. We have seen somewhat of an uptick in calls related to symptomatic people, those who are exhibiting those symptoms. We have seen some uptick in that, so we want the community to be vigilant that with everything else, with COVID, we still have the same call volume that we had before. We still have the strokes, the heart attacks, we still have asthma, we still have all those things that we had before COVID-19 ever showed up. So the idea is to keep the system at a manageable level. We've already heard about spikes and peaks and all those things, but our system has capacity. It has capacity. It has a ceiling. So we're encouraging those to not call 911 if you do not have a true emergency. we still get 911 calls for things that you couldn't imagine. So if in fact you're symptomatic in some way, the directive has been to contact your primary care physician and move in that area. Again, be it Shelby County, be it Memphis, be it all agencies that provide EMS service, there is a capacity. And we don't want to tax the system in a way that prevents those who really need care from getting that care. So that's what we're balancing. How do we provide those services? How do we keep our people safe? How do we do in the best interest of the citizens? And really dealing with that delicate balance, keeping our PPE at a minimum, because every time we go out, we're using protective equipment that probably should not or doesn't have to be used if in fact the system was used appropriately. So you'll see outside even today, we have our ambulances being detailed and washed in a way. We've upped our cleaning schedule. Before they would clean, we doubled that. We expect our folk to even maintain distance at fire stations, don't be in proximity of each other. So we're doing those same things that we can because we're not allowed to work from home like others. So we appreciate the help here, and this has been a great team of people to work with. You'll be pleased to know that all the agencies work great together, which helps us do our jobs. And the leadership that we've gotten from both mayors has been just tremendous, and even the neighboring mayors as well. So thank you.
So we're now ready to open up for questions. Dr. Householder?
It doesn't matter, Dr. Randolph, if you want to do questions, go ahead in.
So any questions for Dr. Randolph, please?
Dr. Randolph, quick question. So when it comes right over here,
Oh, okay.
so when it comes to, you said people who are not complying to the orders, they will receive a misdemeanor. What does that look like? You still have a lot of people who go outside. So is this going to be stopping people as they're walking? How do you control that when so many people are outside?
No, well, it's primarily going to involve targeting businesses. There have been some reports that there are some businesses that are not adhering to the directive. We'll have code enforcement as well as some employees of the health department monitoring that. There's a call-in number that individuals can call in if they happen to see situations where businesses are at parks where there's a crowd of folk and they're not adhering to the separation of 6 feet and no gathering more than less than 10 people, then they can contact us and we can investigate that. The process of issuing a directive first involves what we call the least restrictive, which will be an oral order, which in my opinion we've already given that several times, followed by a specific written order that will be delivered along with the associated supportive copy of the law that will compel them that they must comply or else we will close the business. The health officer has the authority to close a business or establishment, to quarantine or isolate if, in his opinion, he feels that it is a threat to the public's health.
Other questions for Dr. Randolph? And please speak into the mic, Dr. Randolph.
Oh, you can't hear me? Sorry.
Dr. Randolph, could you
Yes.
talk about the issue we're having with surrounding counties and other states not complying with the level of restrictions we have in Tennessee and what danger that's presenting?
Well, all we can do is encourage our brothers and sisters in the surrounding states, because we do not have jurisdiction in terms of encouraging them and having them or compelling them to cooperate. But hopefully they will see the wisdom in doing that. And it's my understanding that there's already been collaboration and communication among the various leaders to coordinate the efforts.
Can I add something to that, Dr. Randolph, just real quick? It's my understanding both Mississippi and Arkansas have recently issued orders that are statewide. And then for a joint task force, both Crittenden County and DeSoto County are invited to participate in the task force and have been engaged in those calls as well. So I do think we really are looking at things from a regional perspective, not just a Shelby County or a Tennessee perspective.
I want to ask about the nursing home, the assisted living facility, and what you all can say about that. I know yesterday there was some talk we don't have to release the name, and today the name has been released, and people in the public were asking us to press the county to release the name if it was not going to come out. So I'm just interested in that that aspect of this and what's being done at that specific facility to ensure that there are no other cases. I know it's a relatively large facility. We were out there a little earlier. So just whatever you can offer.
So I'm going to start with the second question first, and then I'll go back to the earlier question. We have been working with that facility on their infection control practices to assure that they're adhering to the current standards around prevention of the spread of respiratory droplet illness, and that's a variety of things from having adequate PPE, using it appropriately. There's a technique of what they call cohorting, keeping patients with similar diagnoses together and those who are not infected in a different area of the facility, and clearly restricting anyone from coming in and out that doesn't need to come in, and continuous screening of those who do come in and out of the facility. So we'll continue to work with them and assure that they're adhering to that. One of the things that we did do was actually do screening ourselves, and that's why we offered that additional testing. And so if there's a need to assist that facility in additional testing in the future, we'll work with them to get that done. In regards to releasing information, and this is not the first time nor will be the last time that people want me to release information that I may not. I think everyone's familiar with HIPAA and the need to protect individual privacy. In addition to that, there is a carve-out within HIPAA that allows the health official, so that would either be myself or Dr. Randolph, to make a decision about when it's necessary to release information to protect the public's health. When we're working with a business or an organization, our typical process has been to encourage that organization to release their own name. And there have been others that we're all quite familiar with in our community that when they had cases, did a press release and announced that there was cases within their facility. And that's generally what we try to do. It allows the organization to be transparent and share that information publicly. We did work with the organization throughout the day yesterday to issue their own information. At the end of the day, their decision was that they were not releasing that information, and so I made a decision in partnership with input from the mayor and others that it was in the best interest of the public's health to release that information yesterday evening and then to the media this morning. And that'll continue happening, not just with COVID-19, but with any outbreak or infectious disease. We have to exercise judgment in what's needed to protect the public.
Did they offer what can you say about why they chose not to release them
I can't
themselves?
speak on their behalf. I can only speak on our behalf, and I can say publicly that we tried throughout the day to encourage them to be transparent and release that information, and they were made aware that we would ultimately release that information.
A question on testing. So far, 5,506 people have been tested. Assuming that the county has a population of 935,000, that's about 0.5%. So do you think that the testing that we've done thus far gives us an adequate sample of the reach of the virus in Shelby County?
No, it does not. We need more testing, but it has to be the appropriate testing. Any and everyone does not necessarily need to have a test immediately, but we need to test more so we have more information to get a better assessment of and characterization of this virus and subsequent disease it causes.
Have you been able to come up with a common denominator in these cases? Is there a location or a person, kind of a patient zero by any means?
No, we have not.
I have a question about contact tracing. How confident are you all that you have successfully contacted every person that came in direct contact with the infected person and quarantined them? Or is it possible that someone may have slipped through the cracks?
Well, We, due to the volume of cases, we are still behind in our contact simply because of the volume. One case may have several contacts. To answer your question in terms of whether or not a case is truthful and reveal all of their potential contacts, that sometimes could be an issue. And in that situation, someone could perhaps slip through the crack. But our investigative team is very experienced, trained well and thorough in their investigation. And once we start it, and then we tend to contact all those who are what we call close contacts. People who have been in contact within 6 feet, who have cared for someone who's positive, someone who lives in a household with someone, who works in an environment that exposed them. I think we do a very good job in reaching those individuals.
Dr. Randolph, you mentioned appropriate testing. What's appropriate testing? And can you comment also on why the zip code map looks so much different from the heat map yesterday?
But what I mean by appropriate testing is because the testing that we do, we have priorities. So first priority would be someone who's hospitalized with symptoms suggestive of COVID-19. We would need to do the test to help with even the diagnosis. A healthcare worker who exhibits some symptoms, we need to know if this person may be infected or not, because we don't want them caring for patients if they are infected and not wearing the proper PPE. And then there are a second priority of individuals who may have been exposed to someone who's positive for COVID-19 or who have traveled from areas where there is high community transmission and who exhibit symptoms. Someone who has no immediate contact, for example, someone who said, well, there was a coworker who worked in the building that I worked in, but we didn't even come within 6 feet of each other, not even in the same room, and I do not have any symptoms, then that person would not be a priority person. Now, if they began to have some symptoms, cough, fever, difficulty breathing, and then the evaluating healthcare provider would determine whether or not the test is ordered.
If you want to, just one more question. I know you had the heat map question,
Yeah.
so we'll do that and then turn it over to Mayor Harris. You might
The
pose
heat
it
map
again.
will come.
So the heat map yesterday was different than what we're seeing today in the zip code map as far as where the concentrations are.
So when we look at that map, you probably noticed that it sort of favored some aspect of the county than the other, right? And that's a reflection of two things. One is if you look at where the testing sites are and the availability of the testing in terms of transportation, in terms of just having the sites. One of the challenges and one of the things that we want to do is to make sure that we stand other testing sites in other areas. Because again, we want all of Shelby County to be represented in our data so we have a true picture of what it is we're dealing with.
Hey, really quickly, going back to that contact tracing, so what can folks do to make it easier for you all? So I know that you mentioned maybe they're not truthful. Well, what kind of consequences could that have on the community? And then also, let's say maybe if I feel like I was in direct contact with someone who has been tested positive, is there someone I can call and make it easier for your team?
So actually, I want to add a few things about what happens before we actually get notice, because that's where there are things slipping through the cracks. There are sometimes a 6 to 10 day delay between a test, when a test is taken, and when the health department receives that report from the laboratory. So one of the areas that we really need to focus is on when an individual becomes tested, that their healthcare provider instructs them then to remain isolated until that test result comes back. And if it comes back, that they have to remain isolated until they have contact with the health department. In addition to that, they can help identify their own contacts and tell them that they are contacts and should be quarantined. The second sort of safety net is with employers. All day long, many of us receive calls from employers who have actually received a positive lab from their employee. So we're asking employers, if they receive that notice, to please let the health department know, but also then to make sure that employee remains home and not in the workplace, and to help identify contacts in the workplace and send them home for the 14-day period. The quicker we can get a lab result, the quicker we can take action in the contact investigation and tracing. And I continue to reinforce that we use the word investigation because it is a very labor-intensive process to get information from not only household contacts, but social contacts as well as work contacts, and then to contact all of those individuals. So that's beneficial to us. We receive calls throughout the day, some through the hotline, but also through our main number, 222-9000. Many of those come directly to me or directly to Dr. Randolph, and we try to then field those fairly quickly. If we notice that an individual has a lab result, but we have not received it, then we try to reach out to the laboratory to understand why there was a delay in reporting. So I'm actually going to end. I want to make sure I'm respectful of Mayor Harris's time, and I can always come back up at the end. So if you have any questions for the mayor, this would be a good opportunity.
I do want to ask the mayor, we were hearing this morning, some commissioners were saying in the meeting that there is a positive case of someone that works at the juvenile detention facility. Can you confirm that? Can you also talk about the impact that this is having on the budget talks for the county and the concerns that loom around that?
So I cannot confirm the case at the juvenile detention facility. That hasn't come to me yet. There's no doubt about it that the environment we are in will have a negative effect on our budget process and a negative effect on our revenues in a variety of different ways. We proposed to the county commission today, for example, that they prepare themselves to make some cuts so that we can make the coming budget year work. We think that not only will we have to make some cuts because our revenues will be down because there has been so much economic dislocation in this current environment. Not only will that make some cuts here in this budget cycle, but we've also forewarned them that there may be additional cuts that they'll have to make later. So we know that the stimulus package makes organizations that receive funds more or less pledge that they won't lay off anybody until September. And so the budget picture is bad now, and it will darken more as we go through the year. And so we've got to prepare in phase one to make cuts, which is what we're trying to talk to the commissioners about, and to reorient county government, right, to make sure that we are investing in things like emergency preparedness, health department, and social services provided by our CSA and our public safety. So reorient what our major focuses are right now, and be prepared in 6 months to do it all over again. One more word about the coordination efforts. I think coordination efforts regionally are going very, very well. I've seen reports to the contrary, but they are going really well. We're at the early stages of coordinating with folks in Arkansas and folks in North Mississippi, but they are prepared to sync up, to lock arms with us and do whatever it takes to slow the spread. So yesterday I talked with the mayor of South Haven. He is fully on board and committed to doing what he can to promote compliance in terms of social distance. and to sync up with what's going on in Memphis and Shelby County and the surrounding municipalities. I talked to the mayor of West Memphis yesterday too, and he is also very aggressive around promoting social distance and has also issued executive orders along the same lines that you see here in Memphis and Shelby County. In fact, the mayor of West Memphis, I'll just say to his credit, maybe even more strict than some of the executive orders we have around here, because he's also imposed a curfew in West Memphis, Arkansas. So I think there's some really great signs early on that coordination with some of our regional partners is going to go well. Sure, go ahead.
Realistically, are you going to be able to police this sort of idea? Because driving down the road yesterday, we saw hair shops that were open, I mean, restaurants, Title Max, you've got people going to these gas station parties. I heard Shelby Farms is packed right now. Are you realistically going to be able to police this to keep people from this spread?
It's not realistic that we will have 100% compliance. But from what we have seen from the vast majority of residents in Shelby County is that they're committed to making the kind of sacrifices that they can to slow the spread of this virus. We see it all over the place. If you go back home to where you live, there are your neighbors at home. They're staying at home and doing the best they can to help in this process. So are we going to have 100% compliance? It's unlikely we'll have 100% compliance, but the vast majority of people, the vast majority of our residents, the vast majority of your neighbors are committed to putting their shoulder to the wheel and helping, and that's what they're doing. So
what would be the next escalation then if this kind of request is ignored?
So again, I think you've heard Dr. Randolph. He's talked about kind of the process we go to, and I would also refer you to the sheriff. But in those conversations, we've talked about first talking to the non-compliant organization, because it works best with businesses, talking to the non-compliant organization and trying to see if we can get them to make changes. I think that will work in nearly all of those cases. We get messages all day long from people trying to navigate this new space. And all of those messages are, I want to do the right thing. And so I think that's where the emphasis should lie, and not the isolated cases that you refer to. Cases that are be tough, right? Teenagers are at home, right? If teenagers are at home for the next 30 days, teenagers may be found horsing around over the next 30 days because they are at home. We live in the real world, and that is the reality. But we're going to do what we can to have compliance, and I think we will. And I've seen it, Very good. Thanks a lot. All right. Anything else?
Chief Benson? Anybody have questions for Chief Benson?
Yes, I do.
So you talked about, seeing that slight uptick in call volume and that there being a ceiling, a capacity. What's the timeline on if call volume continues to increase? When could your department hit capacity and really not be able to respond to every call it needs to?
Well, we talk about the surge, right? So we don't know exactly when it's going to hit. We know that we have so many ambulances in all of Shelby County. For example, Shelby County Fire Department, we have 11 active ambulances every day. Memphis has a capacity, Germantown, all the agencies have a capacity. So at the point that one call comes in that's exhausted, we've already exhausted our resources, and that next call comes in, at that point the resources are exhausted. It's difficult to predict. Obviously we plan for worst case scenario. We want to call yesterday and spend a whole lot of time looking at what would that look like if in fact we come to that point where we've exhausted capacity. And then, of course, we're going to have conversations about when do we respond, how do we respond, how long is it going to take us to respond. It's going to take us longer. We'll triage calls, we'll triage situations, and we'll just take it that way. At the end of the day, we're going to deal with the most important things first, and we'll prioritize our way down.
But at this point, you're not having to triage calls?
No. Right now, all systems are go. All systems are fine. Employees are coming to work. Employees are motivated. They've been able to separate fact from fiction, which is one real good thing. These men and women come to work every day doing the best job that they could do. So all systems are good across all of Shelby County, all agencies. We talk every day.
Question to the doctor.
Okay. Okay.
If you have this anticipated surge and it overcomes the facilities that the hospitals provide, Have you guys targeted potential locations whereby you can build emergency hospitals, and do these hospitals exist here now?
So at the state level, there's unified command, that is the health department as well as emergency management and military. They're working currently with our emergency management in Shelby County to identify potential locations for a 1,000-bed hospital unit that would be outside of the main hospital. My understanding is they hope to be able to name that facility within days. The governor would likely make that announcement and probably do it in partnership with us, but that's forthcoming relatively quickly. In addition to that, the state has already ordered somewhere between 550 and 600 extra ventilators to have those available as well. And then the key thing that we need to focus on locally is how do we have sufficient staffing to be able to provide care to individuals who need it at the time that that surge comes. And that's an area where if people are retired nurses, physicians, paramedics, or whatever, is to really look at how they might be able to volunteer through the Medical Reserve Corps to be able to provide assistance when we have the surge.
Dr. Household, I know there's more testing expanding, and we kind of had a pretty significant day-to-day jump yesterday. We're taking a step back where we are now. What would be maybe your broad trend of where we are right now? You said more deaths are going to come, likely. Where do we kind of stand right now with where we are in terms of testing and the cases?
So testing, we still are underrepresented in some key zip code areas. You can look at the zip code map to look at that. We have a whole team that is working on expanding testing into those underrepresented communities. Church Health has kindly given us one full-time staff member of theirs to assist with that testing, and Jenny is working daily with others to have testing, not only like drive-through testing, but also potentially mobile or portable testing, and ideally that'll move fairly quickly over the next week or so. Trend-wise, it says some of the same things that we've been saying, but obviously as we're creeping further along that trend, our numbers are still going up. We don't anticipate seeing really significant impact from the social distancing orders for several rounds of the incubation period, so we're really just at 1 week. We want to get it 2 weeks, 4 weeks, 6 weeks, and 8 weeks to see the impact of that. That's important. And then we're starting to see, although the majority of cases, 70%, are still under 60, we're beginning to see more in 60 and above. That's our most vulnerable population. On the morning task force call, we're hearing the hospitals report out, and some of them are reporting as much as 50% of individuals who are hospitalized require ICU beds. And that's an increase from previous weeks. And so we know there's a trend towards more severity of illness.
And to that point, for the second straight day, I've interviewed someone who knew someone who died locally. What would be your message about what that says about how seriously the community should take this, considering we are now dealing with people in this community who have died?
Yeah, I really implore people to take it seriously, not only by recognizing in our community that we've experienced deaths, but to look at other cities such as New York and the impact that it's having and how quickly and exponentially the illness is growing and impacting the most vulnerable populations. And not only that, but also our first responders. I mean, this has significant impact on our ambulance personnel, our nursing personnel, physician personnel, and so on, because they're providing direct care. They're at risk of illness themselves, but also they get compassion fatigue and exhaustion from experiencing such severe illness in people. So the impact is really exponential across our community.
Has it reached a point where you all had to consider possibly containment within individual zip codes, and is that even possible on such a micro level?
So it's not at the current time. The zip code maps are helpful because it does allow us to see where the cases are, but there is underrepresentation, and with the small numbers that we currently have, and I know 497 is a lot, but it's still, if you look by zip code, some of the numbers are under 40 within that specific zip code. We're not at a place to say that that transmission is occurring in that zip code and therefore we should limit movement in that zip code area. But that's one of the things we will look at as we look at the data every day. And we look at the data multiple times throughout the day, so if there's a need to make a shift, we can make recommendations to Mayor Harris directly based on how that data is shifting.
Dr. Householder, can you tell us any more information about that third patient that had died, that you were notified of this morning? Age, underlying health condition, can you release that information?
Well, the 3 that we've had thus far, what I've reported previously, they're in the 50 to 60 year range. I also know that their illness progressed really quickly, so that's another reminder of the seriousness of this, because these are people who are doing fairly well one day, and then they're sick and in the hospital the next day, and so that's the key things that I would point out currently. And I'll take one last question and wrap it up.
Yeah, so a University of Washington study estimated that Tennessee as a state will see peak resource use by April 19th. Does that sound like an accurate estimate for Shelby County?
Well, that's actually consistent with what the preliminary data is from the state predictions. We hope to be able to show some of those maps tomorrow, or at least the peak of that tomorrow. Those models don't take some things into consideration, such as what percentage of the people are really engaging in social distancing. And I have to keep reinforcing, that is the critical preventive strategy that we have, is to stay home and stay apart. And if we do that, we actually will move that date out a little bit further. Okay, thank y'all very much. We'll be here tomorrow at 2.
What a key question.
Thank you. I didn't mean to put you on the spot, but I